Ask you about the pandemic situation. I mean, it's our understanding the SAGE group are meeting today. I don't know if you can confirm that for us. Particularly concerned over the Indian variant. How worried should we be at this stage?
Well, obviously, some of the scenes that we've seen in India itself are heartbreaking, and that's why the UK has done so much to support our friends in India with the oxygen supply that they needed. Obviously, our genome sequencing capability here in the UK is of global class, and we will be helping India and indeed all partners understand these variants better. We have very robust, and we have had for some time now, very robust border control measures whereby people need to be tested before arriving in the UK and quarantine when they do, if travel is essential. So
But it's already here. It's already here, isn't it? We know that some of the COVID hotspots, I mean, particularly Bolton, they think is very much linked to the India variant.
Well, as I say, we've got a world-class genomic sequencing capability here in the UK. We have a huge number of tests, and of course, we have an incredibly effective vaccination program. So, obviously, we keep a close eye on all variants. We want to make sure we're always basing our decisions on the most up-to-date scientific data. But we have seen incredibly positive numbers because of our vaccine program. We will be keeping a close eye on all variants to make sure that we move forward appropriately and safely.
I mean, I know the scientists are looking at this all the time, but certainly the European Medicines Agency, now their position at the moment is that they seem to think mRNA vaccines can neutralise this strain, which seems to be very, very easily spread. But, I mean, that includes Pfizer and Moderna, but not AstraZeneca, not the AstraZeneca jab, which works in a different way. So there's potential of a lot of people in the UK being left vulnerable to this, isn't there?
Well, as I say, we always make our decisions based on the scientific evidence. We have amazing scientific capabilities here in the UK, and all our decisions will be based on science, on evidence, and in conjunction with, as I say, this genuinely world-class scientific community that we're privileged to have here in the UK.
One of the four tests, the key tests in moving down the roadmap out of lockdown is looking at variants of concern, of which the Indian strain is definitely one. One member of the SAGE group telling The Telegraph today that although they think things will go ahead on Monday as expected, they've got real concern that actually the sort of total relaxation towards the end of June may now not happen.
Well, the scientists on SAGE will make their assessments. They will report that to government, and we will make decisions based on the data and the evidence that they provide. The Prime Minister, the health secretary, have always been clear that the easing of restrictions, which allow us to get back to normality, will be done at a pace and in a way which is safe, and we will always be driven by the data.